When it comes to eating heart smart, there can be a bit of a food fight. Diet experts continue to debate about the healthiness of some foods, but certain choices seem to be clear heart health boosters. I'm Lindsay Lippman, and this is a health feature. To help lower blood pressure and cholesterol, the American Heart Association, or the AHA, recommends a diet that is rich in fruits, vegetables, fish, beans, seeds, and nuts, but low in salt, sugar, and saturated fats. Some healthcare providers are also recommending some foods that were once categorized as unhealthy. Dr. Michael Rothkopf, a specialist in interventional cardiology on the medical staff at Baylor Medical Center in Irving, Texas, expands.
So probably the healthiest diet, number one, for a heart patient and for anybody is the diet that helps you lose weight, which is going to be variable from one person to another.
The Dietary Guideline Advisory Committee recently continued its warning against foods that are heavy in saturated fats, because saturated fats may raise the level of LDL cholesterol in the blood. The AHA recommends limiting consumption of such foods.
So starting from several years ago, it was pretty much that diets with saturated fat are known to raise LDL cholesterol in some studies, and that LDL cholesterol is bad for you, especially if you're a heart patient. So we wanted to avoid saturated fats. Saturated fats are the fats that are solid at room temperature usually, so we're talking about fat and meat, butter, shortening, those kind of fats, as opposed to unsaturated fats, which are more liquid at room temperature, would be like olive oil, which is thought to be a healthy source of fat.
Also, watch your insulin. Excess insulin may promote inflammation, and inflammation is linked to risk of heart disease.
What we have found is that heart disease, particularly heart attacks, is a disease of inflammation. And one of the things that causes inflammation in the body is too much insulin. And when you get on the insulin roller coaster, that's when you can have more problems from your diet than if you're eating fat. So the insulin roller coaster is sugar, and sugar is the enemy. So for example, you drink a Coke, or you have a baked potato, which my mother used to think was healthy, and basically it has a high glycemic index, so you rapidly absorb the sugar, goes into your bloodstream, the pancreas goes, oh my goodness, there's sugar all over the place, I've got to put insulin out. So then your blood sugar dives down, 2 hours later you're hungry, you have more sugar, so you get on this insulin roller coaster, and I believe there's a fair amount of evidence that suggests that insulin causes inflammation inside the blood vessels, which allows the blood vessels to actually accumulate cholesterol and become diseased and cause heart attacks. And we all know that diabetics have a very high risk for vascular disease as compared to the general population.
Dr. Rothkopf recommended limiting foods that are rich in carbohydrates. These are processed as sugar in the body and can include white bread, flour, pasta, rice, chips, most desserts, and drinks with sugar in them. And make sure to speak with your doctor about the best diet for you and your body.